Welcome to Sky Women. I'm your host, Dr. Carolyn Moyers, a wife, mom, and board-certified OB-GYN. This is a place to educate, empower, and inspire. Join us each week as we share the power of women's stories. Real women, real stories, real inspiration. Put on your stretchy pants. Let's get going. Welcome back to Sky Women Podcast. I'm your host, Dr. Carolyn Moyers. Thanks for joining me today, wherever you're coming from. I'm answering an important question today, which is starting hormone therapy. What should I expect when starting hormone therapy? So we're kind of going to go through a comprehensive guide to starting hormone therapy. Whether you're experiencing the challenging symptoms associated with menopause, hot flashes, mood swings, disturbed sleep, hormone therapy may be a viable option for you. It is not for all, but it might be for you. And if you have had some shared decision-making with your healthcare provider and feel like this is the right option for you, you might have a lot of questions about what to expect during this time as you start on that hormone therapy. And so we want to just kind of run through that. We're going to explore what to expect when starting hormone therapy for menopause, including benefits, some common symptoms during this initial phase, how long they last, what steps to take if they persist. And I'm bringing in information from the American College of Obstetrics and Gynecology, as well as the Menopause Society, formerly known as the North American Menopause Society. If you want these guidelines kind of in written format, then you can check out our blog at skywomenshealth.com. Click on our blog, and it is the latest blog that was posted. So a couple of disclaimers. So in my opinion, if you are seeing a provider who's initiated you on hormone therapy and they say, here's your prescription, see you next year, I would recommend that you find a new provider, preferably someone who has a Menopause Society, a certified menopause practitioner credentialing, because you are going to get the most up-to-date quality care when it comes to evidence-based hormone therapy. If your hormone therapy isn't working for you, so this is number 2, if your hormone therapy isn't working for you, it is usually one of 3 things, either the dose, the route, or the formulation. And so this is why that close communication is necessary, because if it's not working, if you're having a side effect, rather than just throwing it out the window and saying, this isn't working for me, it didn't work, you give it up too soon, then maybe we need to change things up a bit, and we can kind of talk through some caveats of that as we go. So what are the benefits of hormone therapy? So hormone therapy, also known as menopausal hormone therapy, because we're not talking specifically about hormone replacement therapy like in someone who is prematurely menopausal. In this particular instance, we're addressing specifically menopausal hormone therapy is a treatment that involves supplementing the body with the hormones estrogen, progesterone, and sometimes testosterone that's no longer produced in sufficient quantities during menopause. And while the decision to undergo hormone therapy should be made in consultation with your healthcare provider, it's important for you to recognize what those potential benefits may be. So they include hot flashes and night sweats go away. It significantly reduces the frequency and severity of hot flashes and night sweats, providing you relief that can lead to disruptive sleep. May lead to disruption in the boardroom or when you're leading a team. It can improve sleep quality. So by addressing the night sweats, reducing the sleep disturbances, hormone therapy can help improve sleep quality, leading to overall better rest, better well-being. Sometimes it's going to lead to better sex because you're not so fatigued, right? And our progesterone therapy that is used for those who have an intact uterus should be taken at night, and it helps with sleep significantly. It has a sedative effect, a relaxing effect. And so your progesterone hormone therapy should be taken at night and can help to improve the quality of sleep. Okay. Relief from vaginal dryness and discomfort. So hormone therapy can alleviate vaginal dryness, itching, discomfort, improving sexual function, intimacy, and overall quality of life. Does this always happen with systemic hormone therapy? No. So a large majority of my patients, actually probably half of them, are also on vaginal or local estrogen therapy for the vaginal dryness or the genitourinary symptoms of menopause. Now, it's a mouthful, right? What is that? There's dryness, there's itching, there's pain, there's irritation, there's discomfort. Some patients describe it as feeling like a knife or scraping sensation whenever they're actually having penetrative sex. It's incredibly uncomfortable, and our brain is smart. We do not want to have uncomfortable sex. So, and sometimes it's just noticing your vulva whenever you're sitting or unable to wear tight fitting pants or, your yoga pants. You can't pull on your stretchy pants anymore because it actually irritates your vulva. And so vaginal estrogen, our vagina has a lot of vaginal or estrogen receptors, estrogen and testosterone receptors, and our vagina loves estrogen. So giving back that estrogen with consistent use of local therapy, it significantly reduces this particular symptom. Sometimes systemic therapy will be all you need and it hits the spot. But if you walk in the door complaining of significant vaginal dryness or discomfort with intercourse, and that is a bother to you, typically I'm going to recommend that you have vaginal estrogen. And in my opinion, vaginal estrogen is incredibly safe. It's not just my opinion. I was going to say, in my opinion, everyone 45 and older should have a tube of vaginal estrogen. It is preventative medicine. Vaginal estrogen is like collagen to the face. That is what estrogen is for our vagina. Okay. Prevention or preservation of bone health. So in our first couple of years after menopause, we have the most significant reduction in our bone density. So estrogen helps to maintain bone density, and hormone therapy can help prevent bone loss, reducing the risk of osteoporosis and fractures. So bone health is really important in our menopausal years. I typically have my patients within a couple of years of menopause get their first DEXA scan to look at their bone density. But estrogen helps to maintain that bone density. All right, potential reduction in the risk of colorectal cancer. Have you heard this one before? This is one that typically surprises patients. Studies have suggested a possible protective effect of estrogen therapy against colorectal cancer. Improvement in mood and emotional well-being. So hormone therapy may help to stabilize moods, reduce irritability, alleviate symptoms of depression and anxiety commonly associated with menopause. Now, is it going to solve all of the mood issues? Not all the time. Some patients or some individuals have more of a mind-altering menopause. If you'd like to learn more about this, look at Heather Hirsch's new book, Unlock Your Menopause Type. It's a great read. It's a great resource for all patients. So an SSRI or SNRI, so an antidepressant type medication, may be necessary during this time to help with mood as well, if that is a significant concern, because mental health disorders or mood disorders that have patients who have had an underlying mood disorder may see that return or escalate kind of in menopause when we have this significant change in hormones. Okay, maintenance of cognitive function. So estrogen also plays a crucial role in cognitive function. And some studies suggest that hormone therapy can help to preserve memory and cognitive abilities in women during and after menopause. So this is a big one. Help with that brain fog. Improvement in skin elasticity and appearance. Estrogen contributes to skin elasticity and skin health overall. Hormone therapy can help improve skin moisture, reduce wrinkles, and enhance overall appearance of skin. Now, one of the biggest things I would say about this is if you are a smoker, this is time to stop smoking. Smoking actually will lead to more skin wrinkles. It also can lead to an earlier age of menopause. Okay, so symptoms when starting hormone therapy. The big reason you clicked on this podcast episode, right? What are some of the symptoms you may experience when you're starting hormone therapy? It's important to be aware that there are potential symptoms that could arise during this adjustment phase, but the good news is it's mostly temporary, okay? These symptoms can include temporary breast tenderness. Some women experience breast tenderness or swelling initially, but this typically will resolve within just a few weeks. And what you could do about that is a non-steroidal anti-inflammatory, such as an ibuprofen or Motrin, or even a Tylenol. You can even use cold compresses to the breast or cabbage leaves to the breast. All right, next, spotting or irregular bleeding. It's not uncommon to experience irregular bleeding or spotting during the first few months of hormone therapy. It's generally temporary and tends to resolve on its own within 6 months. But you've probably heard me say before that postmenopausal bleeding is abnormal and is considered cancer until proven otherwise. We take every precaution to rule that out. However, if you've had an appropriate workup, we know that you have a thin endometrial lining and that you don't have any other significant risk factors, and you have this spotty irregular bleeding just with the initiation of hormone therapy, it's something that could be carefully monitored. Okay, but something that you don't want to ignore or forget to tell your gynecologist. Okay. Nausea. So while uncommon, some women can experience some mild nausea or stomach upset when they start hormone therapy. If it is persistent or severe, then it's important to contact your healthcare provider and get seen. But typically, again, this is transient, it's going to go away. Headaches or migraines. So if you have a history of migraines or menstrual headaches, hormone therapy could worsen those symptoms in the beginning, but they, again, generally disappear within a few weeks. All right, and lastly, bloating or fluid retention. Starting any new hormone therapy could have you feeling a little bit bloated as your body adjusts, but again, within a few weeks, this typically will alleviate. So the good news is that the symptoms you experience when starting hormone therapy are typically temporary, should go away within a few weeks to months as your body adjusts to the new treatment. However, every individual is unique, right? And so the duration can vary. And if symptoms persist beyond a few months or worsen over time, it's time to seek medical advice. Now, typically when you're first starting hormone therapy, I would hope that you're not going more than 2 months between seeing your provider to really evaluate how you're doing, what side effects are you having, what could we adjust. So if your symptoms persist or don't resolve, they're increasingly bothersome to you. Maybe it's just something that's bothersome and you just don't want to put up with it, consult with your healthcare provider. Let's reassess your hormone therapy regimen, making any necessary adjustments, finding any alternative treatment options that might be better suited for you, or different hormone combinations that are going to meet your specific needs. So I can't talk about the benefits of hormone therapy and the side effects from initiating hormone therapy without mentioning, when is hormone therapy absolutely contraindicated? Because this is a big one that a lot of patients have questions about. Is it going to be safe for me? Am I a candidate? And some patients who come to me who have been seeing other facilities for their hormone therapy, I am often surprised that they are continuing them on hormone therapy because there is significant risk associated with different medical history and existing conditions. Okay. So that's why it's really important to have a detailed history and physical to go over your personal risk factors for hormone therapy, any existing conditions, medications that you've taken, etc. Hormone therapy is safe and effective for so many, but there are certain circumstances where we're going to say this is not a great option. Let's look at our non-hormonal methods. All right. For instance, if you've had a blood clot after a motor vehicle accident or a major surgery, you still could be a candidate for hormone therapy because those are recurring incidences and it was after a major trauma. So some big red flags or contraindications for hormone therapy would include history of estrogen-sensitive cancer. So women with a history of estrogen-sensitive cancer, such as breast or endometrial cancer, may be advised against hormone therapy due to concerns about potentially stimulating the growth of these cancers. However, if you've had resection and you're 5 years out, a lot of times the oncologists that I collaborate with are telling me that they don't have any reservations with patients going on hormone therapy. So it is important to just have a shared decision making. You share all of your health history. Your provider can provide all of the potential risk and the data around that. Because now, as we look at estrogen therapy and breast cancer, we know that it does not cause breast cancer. But obviously, if you're undergoing, if you have an active breast cancer and you're undergoing treatment, then that's a different story, right? So it has to be personalized to you. All right, history of blood clots or stroke. So individuals with a history of blood clots in the legs or lungs or a history of stroke are generally not recommended to undergo hormone therapy because estrogen can increase that risk of blood clot formation. Uncontrolled high blood pressure. So I did not say individuals with high blood pressure, right? If it's well controlled, fabulous. But uncontrolled high blood pressure, you may be advised against hormone therapy because estrogen therapy can further elevate that blood pressure ever so slightly. Liver disease. So severe liver disease or impaired liver function can affect how the body processes hormones, making hormone therapy potentially unsafe for these individuals. So again, any underlying liver disease needs to be properly evaluated, and this is something that's going to be personalized to you and your specific health history. And of course, known or suspected pregnancy. So hormone therapy is not recommended for women who are pregnant or suspected to become pregnant, as it could have some adverse effects. For instance, if you were on testosterone therapy, and that can have teratogenic effects to the fetus. So, okay, in conclusion, so starting hormone therapy for menopause can provide relief from bothersome symptoms, improve overall quality of life. Understanding what to expect, including potential symptoms during the initial phase and their duration, is essential to managing your treatment effectively. Remember, hormone therapy should always be discussed with your healthcare provider, who can provide personalized guidance based on your medical history and your individual needs. Now, if your internal medicine or family medicine doctor or even OB/GYN is not comfortable having these conversations and providing the options available to you, go to the Menopause Society website and find a provider in your area. Don't hesitate to seek help if the symptoms persist or worsen. These are your symptoms on your hormone therapy. And as alternative options are likely available to you and can ensure your well-being during this transitional phase of life. Until next week, be well.
All right, Sky community, thank you for listening to another episode. This episode was sponsored by Sky Women's Health. As a reminder, we're in the Dallas-Fort Worth area, and we help relieve back pain and pelvic pain in pregnancy and beyond. If you are pregnant and having pain and you feel like you have no reliable way to relieve it, look us up at skywomenshealth.com, request an appointment, and we'll call to get you scheduled. As a board-certified OB/GYN with a Neuromusculoskeletal Medicine fellowship, I help you realign with hands-on drug-free treatment and relieve pain on the spot without medication. We'll help you maintain these results through your pregnancy and postpartum period. Every pregnant person deserves this, and we are so excited to serve you. You can find us on our website, as mentioned, or on social at Sky Women's Health, or you can call the office at 817-915-9803. That's it for today. Until next week, be well.